one of the things you'll get told by Twisted Oak or anybody who's a proponent of this is that the technology they're going to apply will take out 97 or 98 or 99% of the particulates. That statement's true, but it's misleading. What they're talking about is mass, weight. So most of what they're going to take out is PM10, the base, and some of the PM2.5, which is the next layer down. And taking out 2.5 is important, why they're going to take it out. But they're going to take out 98% of the mass. The problem group, the ultrafines, the nanos, the aerosols, and the other new categories, are very small. Trillions of them weigh almost nothing. But that's the problem, because they're so small, so in the end, you get the periphery, that they're going to have an effect. Again, they have much more effect on your kids than they do on you, especially over time. And right now, we don't have any technology available to lessen them or take them out. There are certain people in this community who say, well, we already have bad air quality. You already have a number of industrial polluters. And so, kind of, well, so what, a little bit more, that's a problem. I think there are people in the city government who understand that that's not a good position to take. But let me try and explain something else in one of the earlier talks we did today here about why it's a big problem with particulates. And the way EPA has tended to work on these is they set regulations based on what they thought was a threshold for exposure to something, and below the threshold it was relatively safe, not absolutely safe, but relatively safe. There's sort of a risk equation you can calculate. And above the threshold, the regulation says you can't go above the threshold. So that was it. So I can borrow my task graph over here. This is health effects, right? And this is the amount of chemical. Most of the toxins you're looking at, whether we're talking about so-called criteria pollutants or mercury or anything else, you can go along and for a while you can add the amount you're exposed to, the amount you absorb, and really there's very little effect. And all of a sudden you hit a threshold and whoop, you get a lot of effect. So you see this with lead, you see it with lots of toxic chemicals that, if your lead level is 8, as far as we know, it doesn't do much to you. You suddenly put your kid's lead level to 14 or 15, you can start to see subtle changes. You put the lead level to 20, now we're in deep trouble. Okay. With particulates, it doesn't work this way. Particulates have, and so does dioxin, have what's called a linear dose response curve, meaning as soon as you start to get exposure, you can start to see measurable health effects. 45-degree angle. So, more you're exposed to, whether it's coming from biomass combustion, or whether it's coming from diesel engines, or whatever else, the more risk. So, we know that the more you get exposed to, the more risk there is. Now, one of the other faults in the permitting process for this plant is that if they use Wisconsin's grass, or if they went back to one of the original proposals, I think, about using wood, is you're going to truck the fuel in. One of the unfortunate archaic issues with the current regulations is that the emissions from the diesel engines, which are heavy on particulates, and especially heavy on 2.5, aren't counted in the permitting process. So even though the total emissions from the truck traffic can be a very, very significant number, it's not added into looking at whether the plant should be permitted, etc. So in terms of feeling like the permitting process is a good guarantee to protect your health, unfortunately, again, the permitting process hasn't caught up to the medical science. So they're going to be able to say, we're going to get every permit that IDEM, the state, requires. But it's not going to protect you from the risk that you're going to have from the particulates. Okay? These little numbers, 85 and 35, are on here for another purpose, and not to complicate things, but I'm going to say this because it's important to understand it. The 85 was the start point for a conversation, big conference call I was on in August. GPA put together, a lot of scientists, a lot of physicians. and we're looking at trying to get this regulation, proposed regulation on PM 2.5 sort of settled. Well, the initial start point that they had proposed was the threshold, so to speak, even though we know the threshold doesn't really apply, but the threshold, because that's the way they've always done the regulations, was going to be 85 micrograms per meter cubed. By the time the conversation, quote unquote, got stopped, 3 hours later, the number was down to 35, and it's still not agreed on, because it's really not a threshold phenomenon. It gets further complicated by the fact that most of the evidence that's been published in the last, or a lot of the evidence that's been published, specifically looking at cardiorespiratory function, primarily in adults, shows that it's not just this line that's important. Shows that if you get times where you, for instance, get air inversions, pollution level goes up because the air sort of gets trapped. If you get an increase of 10 micrograms per meter cubed, which is not unusual in air inversions, doesn't matter what the absolute level is. So you could be down here at 15. 15 to 25 has a huge impact in terms of health issues. Right? It's not just what the absolute level is, it's the increase. The American Heart Association and the Cancer Society, and both have come out and said that they think that the current levels of particulate exposure that we're all living with, because we got a lot of trucks around, a lot of industrial plants emitting this stuff, the current levels are responsible for, quote unquote, tens of thousands of deaths a year. And that doesn't address the morbidity issue about how many people are getting sick, et cetera, et cetera, et cetera. So these small particles get into your lungs, they get absorbed. So we know they're cancer related, we know they'll affect how your heart and lungs work. We know that they are responsible probably as a causative agent in a number of congenital abnormalities in kids. We now know that they will actually cause